Hi everyone, Dr. Demito here. Thanks for allowing me to sit in as you begin your journey. Some of you are following the leadership track and others are following the nurse practitioner track, whichever travels you're on. Population health is important. So we're going to be delving for the next 7 weeks over population health and why it's important and should be considered in your practice. So this PowerPoint presentation goes over content in your NASH textbook, Chapter 1. So it's going to talk more about the historic and traditional concepts of public health. Public health is a relatively newer term. Back in the days, I don't know what years, I want to say the early 60s, maybe late 50s, nurses became up close and personal with that term public health, which is now population health, right? But the public health nurse was a very important member of the healthcare community. The public health nurse's responsibility was to get out there and help promote positive health in those who had difficulty with reaching healthcare. So rural areas, impoverished areas, any place where people had a difficult time obtaining the care needed to stay healthy, public health nurses were there doing the job. What comes to mind especially is vaccinations. So public health nurses would go out and they would find people in the hills and mountains and vaccinate them. So they're really pioneers of population health, but it goes much deeper than that. So in the very beginning, we talk about population health and examining its value. It's poorly understood, and the public health results are measured in terms of improved health status, disease prevented, scarce resources, improved quality of life. All those are apparent today. And society seldom links the activities of public health with its results. But it may not link health improvement, I guess you could say, with public health nursing, but that's what it's all about. So you can see your successes if you were to go back and look at, now we've got a big variable with COVID from 2020 to 2022, but you look back at statistics, and you can get these statistics on any sites. I'm trying to think how I got my statistics when I was getting my degree. I think I went on the county health department, and they have statistics. You can look at 10 years of data if you would like, and you can see different trends of health, whether people are having more COPD, more asthma, fewer cases of this or that. But you can really see, it gives you so much information. I was really quite surprised. But the general population doesn't have a clue that those statistics exist. So they may have a knowledge deficit where public health nursing is concerned. So we need to really educate those around us of the benefit of what public health nursing does. In fact, many people in the olden days, that was the nurse's master's degree was in public health nursing. The very first nurse practitioner was a public health nurse practitioner, and that's what her job was, to go out and promote positive health outcomes. So public health, again, it's a core element of population health. And the public health preceded the current focus on population health. And again, as I had said before, that many of the principles coincide with each other. It's mainly a different term where public health is now called population health. And prevention is primary. It's the primary strategy. And I remember, I thought years ago in the 80s when I was very young and in nursing school, I used to think to myself, why on earth aren't insurance companies giving incentives or pushing for patients to lower their cholesterol, lower their blood pressure, maintain their diabetes, get their vaccinations to prevent the long-term events that can occur due to these health states? I mean, I thought about that before I even realized the impetus of public health nursing or population health. All right, so if you want to watch this video, there's a brief video on YouTube about public health, but that's totally up to you. The early influences, it talks about imperialism and industrialization, the British influence. If you want to do that, you certainly can, but I'm not going to require it of you. All right, so the early influences in America. Um, there was a gentleman called Lemuel Shattuck, and his efforts in New England in the 1800s uh, were made him um, one of the founders of this ideology. He was a self-taught school teacher and a statistician, and became a politician. And you can find some information on him again if you're interested. If you go to website with his name, you can certainly find information about him. But federal public health, he was involved in federal public health efforts, committed to the government protecting the general welfare of our citizens, and the Marine Hospital Service, involved into the U.S. Public Health Service Commission Corp. So, important name in public health, Shattuck. Okay. Recommendations that came out of his report that he put together was to establish state and local boards of health, system of sanitary police or inspectors, collection and analysis of vital statistics, routine system for exchanging data on public health matters, sanitation programs, studies of the health of school children, tuberculosis, and control alcoholism. Now, during this time period, tuberculosis was epidemic, and there were sanitariums where people went. They made great efforts to try and curb the rates of tuberculosis. But back in the mid to late 1800s, there still wasn't a lot of knowledge related to bacteria or even the transmission of these diseases. They were just starting to understand these things. And there's a little story of a medical school. There was a medical school. I don't recall where it was, but these medical students they spent a great deal of their time in the anatomy lab. And in the anatomy lab, they were dissecting bodies, and that's how they were learning about systems and all of those things. It was an important part of learning to become a physician. Well, these same physicians, when it was time for a woman to give birth, they would run up to the birthing unit and deliver the babies with these dirty, filthy hands, because back then there was no correlation between bacteria on the hands and the transmission of disease. Well, it was uncounted undercover, probably because of the collection of these vital statistics, that babies who were born of midwives and the mothers who gave birth by midwives, had a much, much lower rate of mortality than those in the hospital. And it was through this that it was uncovered that it had to do with hand washing. So it came to the point then where the medical students washed their hands before the delivery of a baby, and it greatly reduced their amount of mortality for babies and mothers. But it took decades for the correlation of this incident to actually cause an action to occur. Again, because communication, we didn't have computers. Communication was difficult. Spreading the word was not an easy task. So things moved quite slowly back in those days, and it took decades for them to realize that there was a correlation between the two. Now, mind you, the great majority of women did not deliver babies in the hospital. The great majority of women delivered babies at home. So things were totally different back in those days. All right. So here we have some statistics here, errors in U.S. public health. And this is greatly related to Shattuck's report, which launched public health, still battled infectious disease. In the U.S. after World War II, medical care was peaking, and in importance in public health moved to being supportive. In 2001, when we had the terrorist attack, changed the role of public health to include the focus of threats to our population. So public health stayed pretty constant from the 50s up until 2001, when we incorporated that threats to the public into the genre of public health. All right, so when you compare the improvement in life expectancy in the full century with the second half of the century, similar in infant mortality. So the greatest gains were made before medicine was hitting its peak. And that was the work of public health. So consider what condition was most improved since 1950. So let's look at it. Which one was improved? And where do you think we have the greatest gain from 2000 to 2050, which is a ways to go? This also leads me to just introduce the concept of healthy families. And this is a federal initiative. Every 10 years, they come up with an agenda, healthy families 2010 or 2020 and 2030, 2020, 2030. And they develop these initiatives and these goals that they hope to be able to complete within that 10-year span. So, but we'll get into that a little more later on. I just wanted to introduce that concept to you now. But you can look to see here on this chart where you see the differences in life expectancy from 1900 to 2000, how it's gone up, infant mortality rate. So this is the percentage of improvement. Look at tuberculosis, which was a huge threat back then, and infant mortality. So many of these things have made a huge impact. Life expectancy at birth really has not jumped that much, which is kind of surprising to me. But all right, let's move on. Infectious disease trends, public health's value. We help control infectious disease, which has decreased from 800 cases out of 100,000 to closer to 50 cases out of 100,000, which is really quite a stark statistic. So, and we look at this, we look at the crude death rate for infectious diseases in the United States from 1900 to 1996. We should be getting some new data because this data typically comes out every 10 years. So there should be some data here from 2016, but I've not been able to locate it. So perhaps it is out there. You can see a huge gap here when we developed penicillin, the Salk vaccine, polio, and the Vaccination Assistance Act here. So, and look at this influenza pandemic. People don't think that the flu can kill. Look at that huge percentage right there. Okay. So compare the top 3 killers in 1900. They're all related to infectious disease, right? And the top 4 killers in 1997, they're related to lifestyle and behavioral habits. So let's look to see the differences here in 1900 and 1997. 1997, look at that, heart disease. Well, we know that there are a lot of factors that we have control over with heart disease, right? We don't exercise, we're all overweight, many smoke, we don't follow our diet regimen the way we should. And so then let's look up here. Heart disease in 1900 was only 8%. So my gosh, that's a really huge increase. Cancer as well. Look at 23.3, 3.7 in 1900. Now, in looking at these statistics, I could say, well, maybe it's 3.7 because of the limited ability to diagnose back then, right? Maybe we're catching more cases and that's why. But let's look here. 1.1, chronic liver disease, that's down. It was 5.2. Look at diphtheria is not even on the list anymore. Neither is bronchitis. Injuries is not on the list any longer. Diarrhea is not on the list anymore. It's hard to believe that diarrhea was a leading cause of death in the 1900s, but it was. All right, so let's see. Let's talk about the images of public health, right? Some view it as a public health system and social enterprise, but public health starts at the state or local level. And the state gets funds from the federal government, and it is the state that decides how they are going to distribute those funds. And so the goal is to improve the health of the public and to provide government services for those who cannot pay for private health care. General statement of health of a population is when we look at the state level, because as I said, the federal government gives states a certain amount of money, and then it is up to the state to distribute it the way they see fit. So that's one of the reasons we need to become politically literate so that we know wherever we live that our money that we get from the federal government and is getting spent the way we want it spent to improve public health. All right, so let's look at this next one. The science and art of preventing disease, prolonging life, and that's a quote from Winslow, just a couple of. All right, so key public health frameworks, social, ecological perspective of health. And again, we're talking a little bit here, the social, ecological perspective of health, the determinants of health, biologic, behavioral, social, cultural, environmental, and interrelationships. Public Health in America document, it shows the core functions and essential public health services and the systems of public health. Now, you'll be able to read about the frameworks, and we're going to discuss them briefly in this presentation. But again, when you are in practice or if you are in a leadership role, you need to definitely bring that social determinants of health into whatever track you're going in, because it examines how social influences affect health. And some of the questions we ask when we are evaluating their social determinants of health is their ability to have shelter, their ability to buy food, their access to health care. Do they have, there's many different components to that to ensure that they have access to health care, or actually the components of life that would improve their health. I think that makes sense. All right, so let's look at this model. This is the social ecological model, and this isn't referring to the environment, but it's referring to how people relate to the larger world around them. So if you look in the center, it's their innate individual traits. So what does that mean? Those are things they do not have control over: their age, gender, race, And then we go into the outside of that circle, individual behavior, social, family, living and working conditions, and then on the outside, broad social economic, it goes in even further. So this is a certain model of public health. It's called the social ecological model. All right. So public health in America, the vision. I had mentioned this earlier, healthy people in healthy communities, and public health that helps to prevent epidemics and spread of disease. They were very important in when COVID began. That's when it was a good test of our public health system. And I think that we learned a great deal from it. We fell short in many ways. And so we definitely learned that we need to be more prepared. When nurses don't have the special PPE equipment that they need to be able to conduct healthcare, that's a problem. So we learned a lot of lessons from that epidemic that we all survived. Public health services framework. And you can see that this is a circle. It reminds me of the nursing process, to tell you the truth. Monitor health, diagnose and investigate, inform, educate, empower, mobilize community partnerships, develop policies, enforce laws, link to provide care, assure competent workforce, and evaluate. And then it goes around and around and around, and it just keeps going, right? But at the core of it is research. Research is paramount to identify what needs to be fixed in the public health system, or in the community, rather. And here's the population health system. Again, circular, with governmental public health infrastructure in the center. So this talks about components of the public health system. And do any of them surprise you here? Employers and businesses, absolutely. The media, absolutely. Now, how does this affect public health? As in my opinion, because there is a little bit of subjectivity here. So as far as I'm concerned, employers and businesses are responsible for promoting public health by ensuring that the environment that you work in is safe, that there's not asbestos in the ceiling tiles, right? That the air that you breathe is healthy. And the media, I believe, is responsible by not promoting unhealthy lifestyles. That's one of the reasons that things like cigarette ads were taken off television. But you can see that this is, again, all of these different factors here that are important in public health. All right. So systems are often described as input, processes, output. So if we look at the rectangle on the right, it shows the structural capacity, what you have to work with. And the processes is how we're going to do it, and the outcomes are how that's going to be accomplished. So think of these things in macro system. That's the big system. So let's take it let me see. I'm going to try to think of a big system. Okay. Like Endeavor. Okay. That's a macro system. That's the entire health system that falls under that umbrella. Or Advocate. Advocate is it's that macro system, right? And then we look at how that macro system affects public health, the public health system. And how do they promote public health? Could it be the services that they offer, their availability? Do they provide easy access? Do they offer things like vaccine clinics? All sorts of different mannerisms. All right, so the public health system logic model. So again, let's look again. This is input, processes, output. And the three key processes here are the same as the three core functions of the public health in a previous slide that we saw. But the capacity, system inputs, workforce information, organization and relationships, facilities and funding. And then again, access, developing policy, assure, outputs are the actual programs and services. And this is how we determine, this process is how we determine the programs and services that are needed. And the outcomes we should see an improvement in health because of all of this work that we're doing. And so many of it starts with research because we need to find out what needs to be fixed before we just go fixing things that don't need to be fixed, right? So, and I also find too, I believe in the small test of change, that we know that there are gaps in our system, but we can't just go in and fix everything all at once. That would be nice, but it just doesn't work that way. So we need to identify perhaps even a simplified process, and then take that simplified process and develop a policy to ensure the success, and the success will be measured by improved outcomes. All right, let's see. Unique features of public health. Oh boy, this slide didn't work out right for me. Okay. So let's look and see which are the same and which are different than the disease treatment hospital clinic system of health. So when we're looking at these things, social justice perspective, inherently political, unfortunately, evolving expectations with expanding agendas, link with the government, grounding in service, focus on prevention, uncommon cultures. So the focus on outcomes towards which many professionals can contribute is the basic task of one problem solving around health issues. So again, remember, a great focus of population health or public health is on outcomes. That's how we can measure the success of what we have implemented, right? Here we have the public health code of ethics, and how ethics applies to population health. And we can see that humans have a right to the resources for health. So that is a human right. And we also know that humans are inherently social and interdependent. And trust is important in the effectiveness of institutions. Collaboration is key. And it goes on to talk about how the community should have opportunity to contribute to the public discourse. So public health code of ethics, everything is focused on that, where population health, that's how we can kind of ensure that we're on the right track with what we're doing. Public health, we want to mortality and morbidity prevented, increase in life years that cannot be attributed to medical and surgical treatments alone. And there are economic benefits and improved quality of life. So if we can reduce the risk to long-term events from coronary artery disease, we're definitely going to ultimately have greater outcomes. So that's going to be illustrated in our statistics. That's why statistics are so fascinating to me, because they can really tell the story. I'm a data-driven person, so I like to see those statistics. And those are the best justification for what you're doing or what you've implemented. Considered the 10 greatest public health achievements between 1900 and 1999, and that's vaccinations, motor vehicle safety, safer workplaces, the control of infectious disease, decline in deaths from coronary artery disease and stroke, safer and healthier food, healthier mothers and babies, family planning, fluoridation of drinking water, and the recognition of tobacco as a health hazard. It's so hard to believe that that's on there, but I mean, if you look at those old ads from the 50s, they have physicians advertising for cigarettes, right? So, but these are all things, they had no clue that there was a correlation between smoking and lung cancer and heart disease. It took years of research and statistics and data for them to finally identify that that was an issue. So there is a contemporary challenge. So our goal is to improve the health status, right, of the American population, but we have to shift it from reactive to proactive. And we want to promote health and wellness. We need to increase understanding of what needs to be done, and we need to find ways to work together across all political parties, and improve the access to care and increase accountability for the delivery and service. It's really sad when I look to see someone, I work as a nurse practitioner in an urgent care clinic. For a patient who doesn't have medical insurance, and I believe that they need an MRI, it's going to cost them $3,000 out of pocket. They don't have $3,000. So what does that mean? That means that they're not going to have that MRI for me to identify if they have soft tissue injury to a joint, which, if it's positive, is going to end up being untreated and down the road end up causing a chronic condition. So we need to definitely address those things as a healthcare system. And part of the goal of you taking this class is to develop a greater understanding of these challenges so that you can identify how you can work towards the resolution of some of these challenges once you reach that point in your career. Thanks for your time, and I hope you found this a little helpful in opening your eyes as to what population health is all about.